Before we start, I want to acknowledge the traditional land. Doing so is really a public statement to honor the traditional native inhabitants that lived in a place. And it just really honors their historic relationship with the land. My place of residence is Olympia, Washington, and I reside on the traditional territories and ancestral homelands of the Nisqually, the Coast Salish, Cowlitz, and Chehalis nations. I want to acknowledge this painful history of forced removal from this territory and pay our respect to the diverse Indigenous peoples still connected to this land. So let us give thanks to all the tribal nations and the ancestors of this place. And I believe that we will be putting a link in the chat, if it's not already there, to allow you to research the tribal inhabitants that lived where you currently have lived. Next slide. So just a little bit before we dive in about PHIL, or the Population Health Innovation Lab. For us, our nirvana really is about focusing in on the success of multi-sector collaboratives, in particular health-focused multi-sector collaboratives. So we engage in a variety of different activities, one of which is research, and we really like to engage in research that allow us to better inform our practice in working with communities. So today you're going to be hearing a bit about some of our research. Next slide. So I want to acknowledge, without the funding and the support that we've received from Robert Wood Johnson and the Georgia Health Policy Center, we would not be here today. So thank you so much. And our objectives today are to describe the process and the results of a study validating measures for aligning across sectors. We are going to discuss how to measure, collect, and analyze reliable evidence to tell compelling stories about your communities. And we're going to provide you the opportunity to explore the toolbox that was created, so I'm excited about that, and learn about the framework for aligning sectors. So with this, I'm going to turn it over to my amazing colleagues. So we have here Stephanie Bultema, who is our Director of Research and Network Science. We have Emily Christopher, who's with us, a population health research specialist, and Dr. Daniel Lanford, who's with the Georgia Health Policy Center. So with that, I am going to turn it over to you all. Thank you.
All right, thank you so much, Sue, and thanks everyone for joining us today to talk about measurement. We're very excited to talk about measurement and to be here with you. So as Sue mentioned, the project that we're talking about today was a research project that Phil recently completed to look at measurement in multi-sector collaboratives. And I imagine that a number of you who are joining us have a lot of experience in working in multi-sector collaboratives and can appreciate the amount of benefits that come from collaborating across sectors, as sectors can align to tackle really complex challenges that none can solve on their own. So it's really important to measure progress through these efforts and to collect evidence to guide and support the work. But then the challenge comes of, okay, how do we do that, right? How do you measure progress in cross-sector collaboratives? There are some challenging aspects of this, right? Like results may not be measurable for years. You're looking at goals that are really long-term and systems level, and it can make it pretty challenging to gather, up to the minute current data on how you're doing at working towards those goals. There are challenges around the lack of availability of and access to reliable data. And then you also need to gather all this data and then effectively communicate your progress to sustain funding. So these are big challenges for big work that's being done. But despite those, right, we still have to figure out how to measure our progress and report to our stakeholders and the people who are involved in our work some evidence to support how we're doing. So we think that the solution to this is reliable, validated process measures. So when we are able to, as multi-sector collaboratives, shift some of the attention from the destination, right, long-term outcomes, towards the journey, process outcomes, measurement approaches might be more productive that way and useful for guiding progress towards shared long-term goals. The objective of this particular research project was to validate measures for aligning that can be used by MSCs, right? Multisector collaboratives. I've used that acronym a few times to compare, measure, and assess the relative importance of concepts from the framework for aligning sectors. So what we did here, for this research project, we validated over 200 measures of cross-sector alignment. And we looked beyond public health. One of our first steps in developing these measures was to go beyond the traditional knowledge bases where we tend to live of public health, healthcare, and looking into areas like past research and theories and frameworks from diverse disciplines like economics, public policy, business, and more. They have a lot to offer in this space. So we really took a lot of learnings from other areas of expertise. We also drew on Phil's Aligning Systems for Health Research, which is a key resource for this project. We call this our main study or our 2-year research project, and it explores how collaboration and alignment among public health, healthcare, and social service sectors in partnership, of course, with community residents and tribal nations leads to outcomes in 22 ACHs in Washington and California. And finally, we were guided by the framework for aligning sectors. And I want to spend just a little bit of time looking at the framework, just in case everyone isn't familiar. So this is it up on the screen. This was developed by Georgia Health Policy Center's Aligning Systems for Health team. And it is a visual to represent what is needed to have true alignment in a system, right? Allowing for discovery of new, sustainable ways to improve the health and well-being of communities that we're serving in collaboratives. So I want to just point out, or maybe let's see if I can use my mouse, a couple of areas. So down here you see local context, and local context sits at the bottom, and it's sort of indicating that that's the envelope in which everything lives. It's present all throughout. So that's the unique environment of the aligning effort, things like geography, demographics, local events and trends. We have the core components, which are the gears here. These are the primary elements which support aligning efforts. And the adaptive factors are woven throughout. You have community voices, equity, power dynamics, trust. These factors influence aligning and the other elements of the framework as well. Then over here, we have changes in mindsets, practice, and policy as short-term outcomes, and then longer-term outcomes to the other side, to further down, community goals and needs, health equity, and racial equity. So what we used for this study, we used a mixed methods, research design, a realist evaluation lens. So to help us not just understand, does it work, but what works under which circumstances and for whom, really getting a full perspective there. We gathered new data. And like I mentioned, we also relied on some existing evidence from our larger research project as well. So from that main study, we used survey data, documents, interview data, and population health data. So we drew on survey data from 598 participants from 20 ACHs. So it was a really large sample. Preliminary and key informant interviews were done with 65 individuals representing 13 accountable communities for health. And then we also collected almost 700 documents from 22 ACHs. So things like meeting minutes, team governing documents, collaborative planning documents, and data describing each of the 22 ACH's local contexts was from publicly available data sets like the American Community Survey or County Health Rankings. We also did a validation survey, 20 follow-up interviews, and 2 focus groups to gather additional information for this project. And those interviews and focus groups that we did served a few purposes. And we'll get into some of this in a little bit too. But they served to assess the content validity of measures. So that was important to ensure that key indicators weren't missing from our measurement of constructs. They also serve to assess coverage of our understanding of any confounding factors that might be threatening the validity of the alignment measures. And they help to ensure that our proposed measures resonated with practitioners, people who are actually potentially going to use them, and exploring feasibility and utility of measurement implementation in practical settings as well. Just a quick note, because it's so important for this project, on reliability and validity. So measures have to be reliable and valid for their findings to be useful in practice. When a measure is reliable, it consistently yields the same result each time it's used. When a measure is valid, it accurately measures what the researcher intends for it to measure. So here's just some examples of, you can see a time when it's unreliable, not valid either. It's valid, right? But it's not very reliable. It's all over the place. Reliable, consistent, right? But not valid. And this is an example of something that would be reliable and valid. I just like this. I think it's a really helpful visual representation that I actually stole from Stephanie, but I find it very illustrative. Also a note on a couple of types of validity that we looked at here. So we were looking at face validity. So that's, do the measures resonate with end users? Are they understandable? Content validity, are we measuring the full spectrum of what's included in a latent construct like trust or equity? Construct validity, are we measuring the intended concept? And convergent validity, do the measures for a construct match up as we expect that they would? And we also paid close attention to the feasibility and utility of measures and measurement approaches in this project. A quick note on methods. We used a mixed methods approach to address issues of reliability and validity. We used descriptive and inferential techniques in analysis to explore these relationships among the aligning concepts. We used constant comparison analysis and latent variable analyses like exploratory and confirmatory factor analysis and structural equation modeling. So that's what we did. We spent some time, developed some guides, talked to some people, learned a lot of things, but what did we learn? Overall, our research findings provided ample evidence of the validity of aligning concepts and measures. And the next few minutes, so I'll kind of summarize that here. And then the next few minutes, we'll get into more detail on each of these. So we learned that local context is really important and shapes everything. Adaptive factors are hard to separate from one another. They're pretty intertwined. Equity should be considered as a process and an outcome, both. Collective action, representation, effectiveness, and alignment are 4 possible new concepts to include. And we can talk about how that came up and what those 4 look like. So local context shapes everything. There were 5 latent variables that came up when we looked at local context for this, and those were, they're listed here. So local characteristics are things like the size of the partnership and attributes of the population served. Capacity is things like funding levels, the number of staff dedicated to the aligning effort. And then we have racism beliefs, which includes things like whether aligning participants believe systemic racism exists. We have the length of individual and organizational participation in the collaborative, and also levels of individual and organizational engagement. And I mentioned collective action as a possible new core component that was identified. The process for this revealed, let's see, so we identified this through a couple of different means. It was quantitatively, and then it was supported by qualitative data. And up here at the bottom there's an example of a measure of collective action. So the MSC, Multisector Collaborative, has active engagement from organizations representing multiple sectors. So what this factor includes are things like engaging diverse communities and multiple sectors in aligning efforts, effective communication with the broader community, and participants operating in the shared interests of the aligning effort rather than their own personal or organizational interests. And we tested models that included collective action at different positions in the framework. And we found that the model did fit best when it was a core component. And let's see. Again, I mentioned adaptive factors are woven throughout all activities. They just showed up over and over again as being so important to every step you take as an aligning effort, as a collaborative. They are hard to separate from one another. There's a lot of overlap in requirements for each of them. We did validate trust, community voices, and equity, but we had a more challenging time with power dynamics. It was, we found that there's a lack of conceptual clarity about how power dynamics differed from some of the other adaptive factors. Overall, we found that the measures used for adaptive factors do have strong face and construct validity, but there is room to improve the content validity of some of the concepts. So measuring the full spectrum of a concept. For example, trust was one where there were a number of different examples of trust that would be important, that were deemed important to measure to get really at the full spectrum of what it means to trust in this context. And representation showed up so often and was really important. And representation meaning true representation of the community at the decision-making table. So it's one thing to include people from maybe different parts of your community, but it's being at the decision-making table and it's having good representation across a lot of different areas. So things like racial and ethnic diversity, geographic, cultural diversity, lived experience, role in the ACH, the community, and more. And then we also found that equity should be considered as a process and an outcome. So it's an adaptive factor, which we saw in the model, and it shows up as an adaptive factor as equitable processes that demonstrate the MSC's commitment to equity, diversity, and inclusion. But it also shows up as an outcome. And as an outcome, equity is progress towards improving equity in communities or decreases in health disparities. And then we also looked at, we also identified effectiveness and alignment as two potential new short-term outcomes relating to changes in mindsets and practice. So effectiveness is seen when a cross-sector alignment initiative benefits and is valued by participants, and when the initiative increases connections across sectors in a way that advances progress towards communities' goals and needs. And then alignment is seen when a cross-sector collaborative helps partners work together more effectively and reduces duplication of efforts and aligns resources. So that was great. We found a lot of measures that we could use, but really, in order for measures to be used in practice, they have to be accessible. They have to collect valuable information that can be used and be easy to use. And so that was a pretty big component of this as well, just making sure that these measures made sense and that they worked in practice. So some notable themes arose in interviews and focus groups on this topic that I wanted to highlight. First was the need to attribute findings to the ACH's efforts. So it's one thing to say something is happening in a community right now. It's another to say that because of something that the ACH has done, this is the result. Second, respondents generally felt that measures should be more specific to be useful. And I mentioned this earlier with one example, but the construct validity could be improved on a number of these measures so that they are more specific. And then third was the importance of qualitative data collection to assess ACH progress. This is valuable. It's a valuable resource and can lead to a better understanding of the complexities of community experience and the ACH impact. So some barriers that we identified, I mentioned before, data delays, lack of staff capacity and expertise, and data sharing. And facilitators included initial measurement planning being informed by diverse and representative community voices and cross-sector partners. So, and then also data should be collected at a wide range of community locations and be conducted in multiple languages to also facilitate the elevation and representation of community voices. And people, like I mentioned just a second ago, spoke to the importance of storytelling to demonstrate the ACH progress. And many also shared that the qualitative data collection is a little bit more feasible for certain ACHs, especially when they don't have a data specialist or staff to kind of manage that process for them. They were able to collect that information on their own more easily. So there were a couple of limitations, and we overall feel like this multi-pronged mixed method approach to our validation study did provide, a strong foundation, but there were a few limitations. One, we had varied coverage of the framework for aligning sectors, so not all of the measures cover all of the portions, the measures cover some of the portions better than others. There are limitations with generalizability as well. So we looked at ACHs, Accountable Communities for Health, in Washington and California. So there's generalizability questions as far as, beyond those states and beyond ACHs into other types of collaboratives. The measures are subjective as well. So it's just by nature, this research is an assessment of how participants perceive aligning in practice versus objective measures, how it's actually happening, were not measured in this. And of course, the ongoing limitation to everything done in the last 2 years is COVID. So people involved in this research were definitely on the front lines experiencing major changes in their work and likely personal lives as a result of COVID, which could definitely have impacted our responses as well. So we think that the research that we've been able to do in this context is really a leap forward in terms of consolidating and validating measures for aligning, but there is still a lot to do to prepare MSCs for their aligning work. And we will hear about 2 examples of those in just a minute from Stephanie and Daniel, which we think can be really helpful to you, hopefully. Some future work that we think could positively contribute to this topic include validating some additional measures for power dynamics, shared governance, and equity. More specific measures developed and validated for each aligning concept. Identifying best practices for measurement that build trust and centralize community voices. And a comprehensive resource that can guide the measurement work of ACHs. So that's a lot of me talking. Let's change gears, and I'm going to hand it over to Stephanie. She's going to walk us through a tool that we made as a result of this research, and there's a little bit of interactive options at that point. Stephanie?
Well, one of the main things that came out of this project is that we were doing all of this work and we were thinking, my goodness, how are we going to share this information with people? We will be, we've written a book chapter that will be included in the Aligning Systems for Health volume, which I encourage you all to be on the lookout for when it comes out. But we wanted to make sure that these findings were available and accessible to you all much sooner than the book is released, and in a way that is perhaps more useful than a book chapter. And so what we decided to do was to consolidate all of the resources that we use, kind of our primary resources for measuring aligning across sectors, in a publicly available free toolbox. And so I'm going to give you just a quick overview of what this toolbox looks like. And then we're going to offer you all a few minutes to check out the toolbox yourselves, see if you have any reflections or questions about this toolbox. Then Daniel's going to share some awesome work that the Georgia Health Policy Center is doing, and then we'll open it up for larger questions. But right now, I'll just do this quick overview of this toolbox. So our idea is that this collection of resources is something that researchers can use to study aligning across sectors. Funders could use this to inform their funding priorities or their reporting requests of aligning initiatives. Evaluators could use this to assess aligning efforts in cross-sector collaboratives. And we also see this as being a useful tool for practitioners who are looking for process measures of aligning that they can integrate into performance management, reporting, whatever you have there. If you have other ideas for how you see other people using this or how you might want to use this, we would love to hear from you. But this is kind of how we think this toolbox could be used. So I want to point out that there are 2 different ways to access this toolbox. The first way, which I'm not going to go into in great depth, is over here to the right, where you see this little image, Toolbox for Measuring Cross-Sector Alignment. If you click on either the image or download here, you can download a PDF that includes the full spectrum of what I'm going to show you on this webpage. And so if you're someone who prefers to file things away and look at them later, downloading that PDF is the option for you. But just a heads up, it includes all of the same information that is on this webpage. And so I'm just going to go through the webpage for ease of scrolling here. So the first thing that you'll notice is that we have a general overview of each of these sections. The toolbox is comprised of 5 different sections. Oh, and I have these. I'm going to close these all so you can just kind of see the high level before we dig in. So you have the overview, and then you have all of the content, We have 5 different sections, the first one being project background. And what you'll notice for each of these sections, as you expand them, you'll see it starts with just kind of an overview of here's what's in this section. So in the project background section, this is where you go if you want to learn more about the main study, the measurement study, or the framework for aligning sectors. You'll notice that each of the items in a section are all clickable. So if you want to look at the 2-pager, just click on that. If you want to look at the press releases, just click on those. But we also included a short description of each of those items. So you can take a quick pass and decide, is this really an item that is worth my time to click and check out? So everything is there. If you decide that really the project background section is a place for you and you just want to look at everything in here, you can always click this section down here that allows you to access the full folder with all of these items. And you can go and peruse project background to your heart's delight. And so each of the sections follow in this kind of format, where you'll see that there's an overview, each of the items, you can click on each of the items, description of them, and then accessing the full folder if you want. So this next section, measurement overview documents, is the place to go if you really just care about the measures and you just want to know, okay, if I'm searching for a specific measure about, say, engagement or trust, and you don't care about all of the other stuff, go to section 2, measurement overview documents. This is where in the factor overview, you can see all of the discrete measures that group together as a larger factor of a big idea like trust or financing. And so what we did through the analysis was identify, here are, say, 3 measures that group together that can more reliably measure a big idea like trust than if you were to ask just one, say, survey question. And so that's where you can go to get a good picture of how to measure these big ideas. If you want to dig way in, go to the full measure and source overview. This is where we have consolidated all of the survey measures, document measures, interview and focus group measures, all of the different measures, including the sources. Because remember that these measures come from a bunch of different places. The first thing we did was look at what's been done before and pull from good work that has already existed. So if you want to see the full overview, that's where you go. From there, we have a full section on data collection instruments. We've made available here all of our original data collection instruments for the main study and the measurement validation study. So this includes surveys, observation guides, interview guides, focus group guides, all of it. Again, you have a description. And I do want to just note that, so let's open one up and look at it. We did not modify these to be generalized. And so it's not, we didn't exactly put these out in the world and say like, hey, here's an interview guide that you can, just take and use exactly as is for your own purposes. You are welcome to do whatever you want with this. And we included the introduction and kind of background information in case that's helpful for you to use a tool like this. But I see it being more likely that people would look at this interview guide and say like, oh, I want to ask these 2 questions. And so really using these guides in more of a pick and choose fashion. Of course, you're welcome to use the full thing if it works for you, but we recognize that every context, every study, every evaluation is different. And so likely these will be more of a helpful reference and a source for finding discrete measures. But as opposed to like this overview, it might be helpful to see the measures in context and see how we used them. So every measure that's here, you can also see in kind of our data collection guides here. Okay, next up is data analysis code. I do want to note that this is only analysis code for the measurement study. As Emily mentioned, the main study is still underway. And so once we have finalized the code for the main study, we will include all of that code here as well. But for now, you can go to this section if you're interested in getting our script for exploratory factor analysis, confirmatory factor analysis, or the different structural equation models that we tested. And finally, we wanted to include a few additional resources that we really like, or we heard that ECHs really like. So the Powering Change curriculum is just an awesome curriculum for multi-sector collaboratives that includes a ton of different resources, guidance, and is really just a wonderful resource if you're looking to improve your multi-sector collaborative. or even figure out where to start. The integrated framework for collaborative governance is where a lot of measures were derived from in the first place. And so that might be a helpful reference in case you're wanting to dig into kind of some of the origins of many of these measures. And then we also heard from many communities that they really like the Wilder collaboration factors inventory. And so we also wanted to make sure that others know about this inventory that we've heard has been a valuable resource for people. So that's what I've got for the measurement toolbox. Now I believe we have a few minutes that we are going to give to you all to take time and just explore the toolbox. And then if you have any questions, you're welcome to come back with those or put them in the chat. So Emily did a quick overview of the framework for aligning sectors earlier on. And so each of those pieces of this framework are the aligning constructs. So the community voices, equity, power dynamics, trust, those are adaptive factors, each of which is an aligning construct, so like trust is an aligning construct. And then the core components as well, shared purpose, data, governance, financing. Now, the latent variable is, okay, I wasn't looking, okay, I just got the document up. So the aligning construct is the big idea, adaptive factors. And so in that are all of the, those latent ideas, trust. And so a latent variable, in case people aren't aware, is a that can't actually be directly measured or observed in the world. And so it's something that, you know, you can try to measure it the best you can, but it's not something like someone's height or the temperature outside that you can really get a good concrete measure of. And so for that reason, it's oftentimes the best case to use multiple measures of that idea. So the aligning construct would be local context or core components, which include shared purpose, data, governance, financing, or adaptive factors, which includes community voices, equity, power dynamics, trust. And then the latent variable is that piece of that aligning construct that we identified multiple measures that can be used to measure that latent variable. So in this case, for trust, we identified 3 observed measures, these are survey measures, that group together to reliably measure that latent idea of trust, and can do so more reliably than if we just asked if people were trustworthy. And so similarly for community voices, you'll see we have 4 measures that we identified there. But so the aligning construct is the big idea in the framework. The latent variable is the more specific idea in that, like adaptive factors are core components. And then the observed measure, the last column, is showing the very specific measures that are used to look at the latent variable and even bigger, that aligning construct from the framework. But I do believe it is now time to move on to Daniel, who's going to share some exciting work out of the Georgia Health Policy Center that is related here.
All right, well, I guess I'll just jump right on in. Thank you so much, Stephanie. Thank you to everyone on the Phil team. It is an honor to be here, and oh my gosh, I'm floored every time I see this work. This is amazing. Phil has gone so hard and so far in this, and I am super excited to be a part of this and super excited to be here. So I guess where I will start is way back in the beginning, right? Like, so just a quick touch on what brings us here, that we are in the middle of a historic opportunity to really address health in our nation, health and health equity in our nation in ways that we haven't been able to do that before. There is increasing recognition of the social determinants of health, and along with that, the idea that we can do a lot of collaboration across sectors. Obviously, we can keep working in healthcare, but also public health, social services, other people as well. And I guess it was several years ago at the Robert Wood Johnson Foundation, where this all began, there was some reflection on, okay, we've seen collaboration, but there's a lot of confusion. Sometimes they come, they go. how do we know when we're succeeding, that sort of thing. And so that was the beginning of the Aligning Systems for Health project, was how do we think about this cross-sector collaboration in a structured way? And that's how we come to Aligning Systems for Health. And that's where all this begins. So the RWJF got in touch with the Georgia Health Policy Center, and we've been working on this framework. It's developed over the years. And we've been working on this process of thinking, like, what can we do to contribute to make it where we're not in a wilderness? Some of the information that's all over the country can be consolidated, and we can move ahead with really effective cross-sector collaboration. As we started jumping into this work, there was this question from so many people across the country, which is, okay, we've got some ways of thinking about this, but how do I know if I'm aligning? And there are a lot of answers to that question, but it started us thinking of, okay, so how do we start with, why don't we conceptualize and measure this stuff? We need ways of measuring aligning specifically beyond what people have had for collaboration a long time ago. And so there was this whole process of beginning research across the country, of which Phil has been an incredible part, and we've learned a whole lot from and continue to learn from, along with a whole bunch of other folks across the country. And so as everyone has started this work through the Aligning Systems for Health project, we were thinking, okay, so how do we start to consolidate what we know about measurement from all these different places? And that's where we get to the measurement system that I'm about to talk about, of which the material that Phil has informed and is a part of, and we'll continue to, so you can see the kind of relationship between those two things. Of course, the package that Phil has right now is incredible. They've got surveys, there's a bunch of background, there's all that information, and that is an incredibly useful tool that I'm super excited about. The measurement system that I'm going to talk about, like I said, incorporates some of that, as well as the work that everybody else that's been a part of this Aligning System for Health project has been putting in there. So this is where this started, sensing the field, where everybody's at, what everybody can contribute, what everybody's doing, gathering information through a bunch of grants with Phil, with other people, with our own research at the Georgia Health Policy Center, building on RWJF's experience, talking to everyone, interviews in our communities, the whole shebang. And then we've gotten into the process of developing this grand measurement system where people can start to think about this from a broad angle, from a really broad perspective, I should say. And so that's how we get to the team. That's what we call it, the tool for everyone aligning and measuring, the team. Many parallels to what you've heard already from this scale that encompasses the work of so many people. All right, so let's see here. Thank you for the next slide. Very similarly, actually, it's got introductory material and guidance, because there's a lot to talk about with measurement. There are a lot of pitfalls, a lot of snares you got to look out for, and of course there's a lot of benefit for different types of folks doing different types of things. So there's a lot to think about, so there's a lot of guidance there. There are 4 main elements of the team. So the base set is basic measures, right? So the original question that started all this was, how do I know if I'm aligning? Aligning is a certain kind of cross-sector health-oriented collaboration where I'm paying attention to certain things. And so the base set has some really basic questions about, okay, are you doing this? Are you doing that? Then I guess we could say we're aligning. It's not necessarily, are you doing great? Are you not doing great? Could be doing really good things and not be aligning. The same works conversely, but it's a really basic set. The featured set takes measures like the ones that Phil has, like folks like the Pathways Community Hub Institute has. We've talked to DASH, AIR, just tons of organizations across the country. We've gone through that and said, okay, what are we seeing time and time again that people are talking about? And we've organized it into those elements or constructs, as Stephanie was saying earlier, of the framework for aligning sectors. So there's a whole bunch of questions you can ask yourself, whether depending on what your purpose is, what your role is, on self-reflection, in a survey, in interviews, when you're gathering documents, if you're part of an evaluation, if you're trying to have a meeting of minds in your local collaborative, it can be used for all those purposes. But that's the featured set of measures. There's also a tool, the GRASP tool, the group assessment for aligning systems for people, where people can all come together in a collaborative, or whatever element of that collaborative feels like is representative, its constituents, where people talk out how they feel about this and sort of create a self-rating. We understand that's important to a lot of people. You're not necessarily trying to compare. You're not even interested in using measures that other people have, but it offers you a way of doing this as a sort of self-rating. And then there's a compendium, which is the fourth main part, which is a collection of all the measures and tools that we've encountered in the course of this project. Now, this is a lot, it's really big, and it's changing every day, right? This is a living field effort. We are moving a first draft of this online right now. I only wish that we could be sharing this with you and clicking through it like the toolkit that Phil already has prepared. But soon that will be out there, and I want to talk about some of the ways we can get into that. I think I'm kind of running out of time, though. I've been long-winded. Oh dear, I think my circle is in the wrong place. That was supposed to be over compendium. You can send stuff now that has to do with measurement and cross-sector collaboration, and we can get it in that compendium as it's going online. But if you'll go to the next slide, I want to convey the idea that all of this stuff is something that we consider a living thing, a process that we hope everybody feels like they can be a part of. And with that, I think I'm going to pass it back to Emily for opening it up to questions.
All right. Thank you so much, Daniel. We're so excited to see what this looks like when it's able to be released. And that is, I just wanted to close with a little, what now? Like, it's okay. So we've talked about all this. Now, what happens moving forward? That main study we mentioned, and I know Stephanie touched on this too, that's ongoing. And as we have exciting findings to share with you from that, then we will send out an invitation through our listserv. So be on the lookout for that. The measurement toolbox is available right now. Go check it out. Use what you can, or also if you find that you need additional support on measurement or anything else in your MSc, please contact us at info@pophealthinnovationlab.org. We would love to support you. We have a few minutes and just want to hear from you all if there's anything sticking with you or anything confusing about what we've talked about so far. Jessica asks, can you speak to the strength of the network versus strength of alignment? Are those things the same?
I'd be happy to speak to this, but Daniel, I'm curious what your thoughts are.
Go for it.
Okay. Well, in my mind, they are kind of talking about different things. So the network is the structure of the organizations, the groups, the people that you are working to align. I mean, it could even include things like ideas or policies, depending on how complex you want to get with your network. But when you talk about alignment, you're talking about a quality of that network, of those people, organizations, groups that are coming together in some way. And so it's not even like not all networks need to be aligned. That's not the purpose of all networks. They serve lots of different purposes. But in this case, in a health-focused multi-sector collaborative like an ACH, the whole idea is bringing together diverse actors to work together toward a collective goal that none of them could achieve alone. And for that reason, this type of network, an ACH, alignment is critical. It's at the center, bringing everyone together and getting everyone on the same page, moving in the same direction. And so that's my thinking. A network is a structure. It doesn't have to be aligned. Not even all networks would want to be aligned. And alignment is more a quality of the network. Daniel, does that match up with how you think of it? Do you have anything to
I think
add?
that's very consistent with how I look at it. I think aligning is what a lot of people think. If we think about those items in the framework for aligning sectors, it's going to give us the opportunity to be a strong network. There's a lot of evidence for that. Now, having said that, this is one of the reasons that Phil and JHPC are super interested in measurement. It's like, how do we learn more about this? How do we know this, and how do we understand this in our own context and across contexts? So it's not a one-to-one, but what we have, at least in the measurement system and the team, is our best understanding of the multitude of voices suggesting if you want to have a strong network or a strong health-oriented cross-sector collaborative, these are some things you might want to think about.
Is there learning or things to build off of from the tech world or cable internet service providers? I would love to hear more, Jessica, about the background on that question. I have some initial thoughts, but I'm not quite sure if they're related to.
Well, tech platforms are networks, and
Yes.
you're right that not all of the folks on a platform are going to be aligned. I mean, we see that very clearly, and actually it's a sort of potential threat to our democracy or threat to our democracy, depending on where you are on that spectrum, because of the way that information is communicated and the way that alignment starts to work in those spaces. So the network is just the structure. I think of coral reefs, or in the natural world, there's lots of like things that create structure for networks. But then I was also trying to figure out, like, you know, if you're part of Verizon or AT&T or T-Mobile, you also have like some amount of structure and function that match so that there's alignment in a network. So there's just some terms that are being used across other sectors where they've thought really deeply about how to both create a network and alignment of the goals around that network. So folks, and I'm, it's like the way that in the quality world we learned from, like, air traffic, airplane, and the world of the airplanes and stuff like that. So there are other spaces we can learn from. That's the spirit of the question.
That's super helpful. Thank you, Jessica. Are you familiar with network science and network analysis by chance?
I probably not too deeply, except for complexity science work, but I don't know if those have overlapped.
Yeah, they're very similar. But so in network science, and more specifically network analysis, there are measures and approaches to assessing any network, whether it be a structural network, like, computer networks, the internet, or social networks. You can use the same methodological approaches in network analysis and use the same types of measures that can actually, quantitatively measure alignment and also guide improvement of a network based on these theories of network science and methods found in network analysis.
Can I just say, Jessica, I really appreciate you bringing this up. I mean, there's that notion of analogous inspiration, like going to other fields to see what are they doing that we might, consider. So thank you. I think we sometimes get in a little health bubble. So thinking about other sectors is really important. So thanks.
Absolutely. Okay. Well, thank you everyone for your questions. I want to just be considerate of everyone's time if there are engagements starting in the next 3 minutes. So I just wanted to share one more thing on here. Well, in addition to just saying thank you. Thank you for joining this discussion and for talking with us for the last hour. And a special thank you as well to the Robert Wood Johnson Foundation, Georgia Health Policy Center, for supporting the research, and to all of the ACH representatives who participated in our main study and the measurement study as well, because we gathered all this information thanks to their support and insights. And also thank you to the Phil team for putting together this web discussion today. So you can learn more about us. Here's our here's our website, healthinnovationlab.org. You can follow us over on Twitter at PH Innovation Lab. And thank you.